This podcast is part of the clinical series, where we will be presenting common diseases and its treatment. On our first episode, we will be presenting the case of herpes zoster, or commonly called shingles in layman's term. We will be discussing the clinical presentation and management of shingles. It is important to detect early the signs and symptoms of shingles in order to be treated early, since early treatment may shorten the shingles infection and lessen the chance of complications. The most common complication is postherpetic neuralgia. This is a painful condition that causes shingles pain for a long time after your blisters have cleared. An elderly patient who have not received the shingles vaccine will suffer from this postherpetic neuralgia for months and years. What is herpes zoster or shingles? Herpes zoster or shingles is a viral infection that occurs with the reactivation of the varicella zoster virus, the same virus that causes chickenpox or varicella. After you had chickenpox, the virus will remain dormant and stays in your body for the rest of your life. Years later, the virus may reactivate as shingles, particularly among the elderly people when the immune system is down. It causes a painful rash or a vesicular lesion that may occur anywhere on your body. What are the signs and symptoms of herpes zoster or shingles? The clinical manifestation can be divided into 3 phases as follows. The first phase is the pre-eruptive phase, where the patient suffers from preherpetic neuralgia or nerve pain. This sensory phenomena will present as pain, burning or tingling along the infected skin or dermatome and is sensitive to touch. This may last for 1 to 10 days or an average of 48 hours only. The pain may simulate headache, cardiac pain, or other intra-abdominal disease. In some cases it may present in a atypical manner. Other symptoms may include malaise, myalgia or muscle pain, headache and uncommonly fever. The second phase is what you called acute eruptive phase. This is marked by the appearance of painful rash, or the vesicular lesions on the unilateral side of the body. The red rash that begins a few days after the pain will form into a fluid-filled blisters that break open and crust over time. The symptoms tend to resolve over 10 to 15 days, but with early treatment of antiviral medication, the duration will be shortened. The third and last phase is the chronic phase. This phase is characterized by the persistent or recurrent pain lasting for 30 days or more after the acute infection. The pain is usually confined to the area of original dermatomal involvement. The pain can be severe and incapacitating, especially among patients 50 years old and above. The pain can persist for weeks, months or years due to postherpetic neuralgia. Shingles isn't life-threatening, but it is very painful. Thank you for listening. Your host, Dr. Arden Zara, family physician. Have a nice day, everyone.